My name is Patrick Gill, and the policy skill I will be discussing is the effective use of community engagement to influence public health policy. This is obviously a huge need in the United States as a whole, and specifically in disadvantaged communities that social workers often interact with. The United States falls behind um, other developed countries in almost every measurable public health metric, to include infant mortality rates, obesity, cardiovascular health, and many other issues that result in sickness and premature death. Um, Social workers are in a unique position to influence public health policy because of the 650,000 social workers in the United States. Over half of them have some interaction with public health policy. So on a micro level, they're able to help influence policy because they should have relationships within the community with community leaders, and potentially could also know local politicians that could help influence policy. And on a macro level, social workers should be constantly interacting with the Department of Public Health, other public departments, politicians, and other people that influence policy. So an example of this being successfully implemented was the San Francisco Health Improvement Partnership, which lasted from 2010 to 2016. And it was able to accomplish all three goals that were discussed in the crash course in social policy video in Module 1. It was able to protect Americans from risk, promote equal opportunity, and assist the poor. And so it's also an example of how to effectively run a community engagement program and implement other sources throughout. So it was spearheaded by the San Francisco Department of Public Health. They also incorporated UC San Francisco, the local university, and many nonprofits in the college. And the nonprofits were able to help with gathering data from the community, but also to analyze the data from the last several years with the community and interpret and recognize issues the community was facing. Most importantly, they used a massive amount of community involvement throughout the process. So community members were involved from the start, filling out questionnaires, participating in focus groups, all the way through the policy implementation. And so at the end of the 3 years, all this research and all the questionnaires and focus groups, they were able to identify three main needs within the community related to public health. Those were obesity-related disease, alcohol-related violence, and children's dental health. So for obesity-related disease, they focused on sugary drinks, which are 36% of the sugar consumption in our country. And they discovered that 34% of Black youth and 24% of Hispanic youth were consuming at least 2 sugary drinks a day, compared to 4% of white youth in the San Francisco area. To combat this, they were able to have warnings put on sugary drinks. They were able to have the sugary drinks removed from hospitals. And maybe most importantly, they were able to establish places where community constituents could access clean tap waters. So examples of this were libraries, public parks, schools, etc. The second one, alcohol-related violence. They discovered that 10% of the year's loss of minority male life in San Francisco was related to alcohol. And they also discovered that there were 75 alcohol distributors per square mile in San Francisco, compared to 10 per square mile in the rest of the state. So to combat this, they were able to make it illegal to sell powdered alcohol. They were able to identify places where there was a lot of alcohol-related accidents and attempt to make them safer. And one of the great examples of how they were able to influence policy is Starbucks and Taco Bell were trying to get their liquor license in San Francisco. And the group was able to put pressure on local politicians. And then once Starbucks and Taco Bell realized the negative PR they rescinded their request to sell liquor. The third one, children's dental health. They discovered that 35% of minority children in San Francisco were already experiencing dental decay. So to combat this, they were able to establish the position of a full-time dental specialist in the community. They were able to procure $250,000 to put towards this cause, and they were able to incentivize local clinics to administer fluoride to young people, because the majority of private dentists in San Francisco do not accept Medicaid. So this this program was successful because, first of all, it was implemented by Governor Newsom, so there was obviously there was motivation for politicians to engage, and it was also successful because they involved the community in every step of the process and were able to identify the needs of the community. And lastly, they were able to recruit a large number of nonprofits that collaborated with the San Francisco Department of Health to go through data and establish evidence-based practices that combat the public health problems that the community was facing. Thank you.